A very good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic. Globally, we are looking at 73.6 million cases of the coronavirus with at least 1.64 million deaths. In the United States, we are at more than 16.8 million cases with at least 305,000 deaths. This week surely has been a grim milestone for this country with surging cases as well as record number of deaths. Yesterday, we surpassed 3,000 COVID-19 deaths for the third time in a week. This is the third highest total since the pandemic began. The biggest news and a ray of hope has definitely been also visible with the rollout of the first vaccines this week, with Pfizer and BioNTech vaccine being given for the first time to frontline heroes and residents and staff of nursing homes. The officials of Operation Warp Speed of the U.S. government have said that 2 million doses of the Pfizer-BioNTech vaccine are set to be delivered next week, and starting as soon as Friday in Ohio and Connecticut, vaccinations will begin for long-term care facilities. While there is definitely excitement and hope, experts again are pleading all to maintain CDC guidelines and especially wearing a mask. Meanwhile, to relieve the economic ramification of COVID-19 pandemic, lawmakers are trying to close in a roughly $900 billion COVID-19 stimulus deal, which may include another round of stimulus checks and benefits. More in politics, President-elect Joe Biden, who has been officially confirmed by the Electoral College, continues to build out his team during the transition process, while Senate Majority Leader Mitch McConnell and others congratulate him on his victory. President Trump still continues to deny the results of this election and has yet to concede to President-elect. So where do we go with this political impact during this devastating pandemic, and what hopes are the vaccines bringing in? We have tonight doctors, officials and community leaders discussing much on COVID-19 and the Biden-Harris incoming administration. Here are the headlines. Electoral College confirms President-elect Joe Biden's victory, featuring veteran journalist Rohit, Vyas, New Jersey. Consulate General of India commemorates World Ayurveda Day 2020 webinar featuring Ayurveda in everyday life, New York. Hackensack Meridian Health begins COVID-19 vaccine 1A, New Jersey. It's time for a short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome again. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Let's begin by taking a look at the coronavirus pandemic's measures and updates. Today, inoculations of the newly approved Pfizer COVID-19 vaccine entered day 3, set aside for doctors, nurses, and other frontline medical workers, along with resident and staff of nursing homes across the nation. A second vaccine from Moderna Inc. could get emergency use approval this week, just like the Pfizer approval as well. On that, the Hackensack Meridian Health was among the first U.S. hospitals to administer the COVID-19 vaccination in New Jersey. Doctors at the hospital are calling this a beginning of the end of this nightmare of a pandemic, and Dr. Lisa Tang from the Hackensack Meridian Health was among the first of a network of roughly 36,000 team members and physicians to receive the first dose of the highly anticipated vaccine before a live audience. The hospital CEO, Robert Garrett, called it a truly remarkable day, saying that they were so honored to make history as one of the first vaccination sites in the entire nation. Held at the Hackensack University Medical Center, here is the story on the first inoculations of the very first COVID-19 vaccine.
This is, in my opinion, truly the beginning of the end of this nightmare of the COVID-19 pandemic. It's the good news that the entire world has been waiting for and needs right now. And Hackensack Meridian Health is so honored to be making history as one of the first vaccination sites in the entire nation. First, I want to recognize and thank our healthcare heroes who have battled this pandemic for nearly a year. Their extraordinary skills and compassion were put to the test like never before. And I'm humbled by their courage and by their resilience. When the books are written about this relentless pandemic, they will be remembered as true American heroes. Let's give them a round of applause.
You know, it's a very, very important thing that our healthcare workers are the first to go through the vaccination process for two big reasons. The first is these folks have been living in the middle of this war. We always said that one of the greatest risks of the COVID-19 pandemic was the overwhelming of the healthcare system. And this team has seen it. They've bent, never broken. They've rebounded and have had to bend again with this second wave. So getting them protected is the smartest, best act of grace that this country could ever do. The second reason it's really critical is that for folks who've been living this every day, like these folks, to roll up their sleeve and stick out their arm and said, give me this vaccine, is an example to the rest of the country to let everybody know that this is safe. We believe in it. We trust it. We're going to do it. We're going to recommend it to our family, and we're going to make this happen.
The best team that I was on understood that we had to put our differences aside. We had to become a team and be focused on that one key mission, that one key mission, and that is do the best that you can do and be the best that you can be for your teammate and for the team. With this, everybody is on the same team. It doesn't matter where you're from, how much you make, what your religion is, what your political position is. Everybody is on the same team. And I would just strongly encourage, again, especially those in the African-American community, those who look like me, to not be afraid, but to step forward and do it, if not for yourself, for others in your home, in your community.
So this is a historic moment. I'm grateful to our team members who have continued to provide patient-centric care during COVID. This journey continues for us since March, even before the first patient walked into the doors. The team was prepared, the team was ready, and committed to providing the best care possible to our community. And they have my eternal gratitude for that. I'm humbled and privileged to be representing the HUMC team. But I'm also very cognizant of the lives that have been lost and impacted by COVID. It has touched our hearts, and it has totally changed the world we live in. The vaccine is a triumph over the fight against COVID. I have trust and faith in the science behind it. That is the reason I will be taking the vaccine today. HUMC has treated multiple COVID patients, and I'm proud to say we have discharged more than 2,000 patients to their homes, to their families, and restoring their quality of life. Today is my way of paying it forward to ensure immunity and safety for our community, for my peers, and all the loved ones that you have back home. Please, physically distance, wear your mask, wash those hands, and get vaccinated when it is ready and available. This is my ask, and I think it is an important step that we take towards ensuring that we continue to live healthy lives in the future. Thank you so much.
Okay, Dr. Joe Underwood, who is the chairman of our emergency department at Hackensack University Medical Center, will be vaccinating Dr. Tank at this time.
Ready for this? Yeah, ready. That was good, Joe. Can you feel it?
Let's give Lisa a round of applause. Okay, first question. How are you feeling? Okay.
And to
Everybody heard
Dr.
that?
Underwood, thank
She's
you.
feeling great. Thank you, Dr. Underwood, for that as well.
As we looked at putting together the cohorts of people who would get vaccinated, the first thing that we realized is that, as Bob said, the difference between the very first people and the last of the patient-facing team members is a couple weeks. So we're not talking about a really big difference. And so we're confident that we're going to get our team members vaccinated and folks are going to be safe. We really looked at this predominantly, first of all, taking the 36,000 HMH team members and dividing them into people who were patient-facing and people who were not. And then within the patient-facing cohorts, we actually look at their risk of exposure to COVID. So those folks who are taking care of patients in COVID units, our doctors in the emergency department, our nurses and doctors in L&D, which are kind of the high exposure areas. And so we start with them, but we're going to have enough vaccine to cascade through that whole workforce in about 2 or 3 weeks.
This month commemorates the 5th World Ayurveda Day 2020, dedicated to creating a sense of awareness and understanding of Asian system of medicine, Ayurveda, and its principles of healing in society. Ayurveda is an alternative holistic medicine system with its historical roots in India. Prevention of disease and promotion of health is the main agenda of Ayurveda. This World Ayurveda Day has been an initiative of the Indian Union Ministry of Ayush since 2016, which organizes numerous activities across the globe as well as at the Indian consulates on the occasion. This year, with the theme of Ayurveda for COVID-19, the Consulate General of India in New York hosted a webinar titled Ayurveda in Everyday Life to promote its benefits of Ayurveda in living a mindful and healthy lifestyle. Addressing the webinar was Indian Consul General Mr. Randhir Jaiswal, along with the members of the Ministry of External Affairs as well as the Ministry of Ayush of the Indian government. Here is the story on World Ayurveda Day 2020.
Welcome to the special celebration of the 5th Ayurveda Day, which Consulate General of India is celebrating in partnership with Boston Center of Excellence. We have some very prominent speakers with us to discuss how Ayurveda has become a part of everyday life. Ayurveda, the science of life, has been seen as something which is used as an alternative means of therapy.
Good evening, everybody. It is my pleasure to welcome you to this session on Ayurveda that this consulate is hosting along with Boston Center of Excellence. I must begin by extending you warmest wishes on Ayurveda Day. A very warm welcome to our distinguished panelists and our moderator, Dr. David Frawley, Dr. Balram Singh, Dr. Mark Halpin, and Mr. Kanchan Banerjee. Ayurveda Day is being celebrated with a lot of happiness and joy in India and as much in every part of the world. I was in a session earlier and some of the speakers had this to say, that even though India, Ayurveda grew and was born in India, it is really universal in appeal and universal in scope. And for that reasons, and for the reasons that Ayurveda is a science which has deep roots, and as it happens with everything deeply rooted, it is bound to grow and expand. And that is what we see. In the last several years, the expanse of Ayurveda has widened. In India, of course, it is part and parcel of our daily life.
Dhanvantari, who is known to be the healer of our health and provides all the wealth that is called wealth. That's why Dhanvantari Divas is also called Dhan Divas. That means this is the 13th lunar day, 13th lunar day of this month, and this is called Dhan Divas. Many people around the world celebrate it as collection of wealth, but ultimately the message is that if you have good health, that is the best wealth we can have.
Even this day, I've been involved in programs as far away as Brazil, the Netherlands, and Saudi Arabia. There's no part of the world where Ayurveda has not gone. And it is also very active, of course, in North America, and is also undergoing a renaissance in India itself. And in this context, I remember when I started this some more than 40 years ago, Hardly anybody knew what Ayurveda was in the West. There were no Ayurvedic schools or books. And even in India, it had kind of a background place. It wasn't given a place of respect. So all this has changed dramatically. We have global Ayurveda with global yoga, with the global Indian diaspora, and with the great interest in natural healing, alternative medicine on so many different levels, which are all encompassed by Ayurveda. Ayurveda includes every aspect of healing. It includes all aspects of diet, herbs, massage, oils, even the use of drugs and surgery comes under Ayurveda.
Thank you, Kanchan Banjarji, for inviting me to join you all today. And thank you to the Boston Center of Excellence for putting this program together today and bringing such a wonderful group of people together, of teachers together, and attracting so many wonderful people who are online watching today's program. I'd also like to thank Balram Singh for his beautiful presentation on science and all of the wonderful work he's also doing with the Boston Center of Excellence. And of course, the Consulate General of India and the beautiful work that they are doing in promoting Indian traditions all around the world. And I think that Ayurveda Day is a beautiful way to do that.
If I had to just make one statement, your question was whether this will be able to replace allopathy, modern medicine, or it will remain only as a complementary. I feel, as a scientist, somebody who's deeply interested in this, and I think we are making some headway. I think science will be changed. And it is very important that Ayurveda plays a major role, and I think it will play a major role as both Mark and Bamdevji mentioned about, how science is coming around to it. And more importantly, though, I think it will be the Ayurveda will let people not be sick. I mean, we are only talking about allopathy is only treat sick people. Ayurveda is something that makes everybody not sick. And so in a way, Ayurveda elevates the life beyond just, medicine and science. It's like, you start, Mark was talking quite a bit about it. The whole lifestyle becomes very scientific. And so it elevates everybody to the level of scientists. Most people will be living like that. There will be some who will need some help. And that will be in the form of teaching that both of these gentlemen do. They teach their students. It will be the same way you will be teaching the public, where they will become more scientists, and which is what I think is the beauty of Ayurveda, is that it will elevate everybody to be to the level of a scientist.
It's time for the short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Let's now take a look at the U.S. politics and the ongoing transition into the Biden-Harris administration. President Donald Trump has still yet to concede to President-elect Joe Biden, even though Republican Senate Majority Leader Mitch McConnell congratulated the president-elect for the very first time after the Electoral College confirmed a Biden win this election cycle. President-elect Biden has continued to build out his team during this transition process and has nominated former South Bend Mayor Pete Buttigieg as his Transportation Secretary nominee. Meanwhile, today, U.S. Congress leaders have been nearing an agreement on a $900 billion coronavirus aid bill that would provide a round of direct payments to Americans and new unemployment benefits. Facing a deadline to avert a government shutdown on Friday night, lawmakers also want to come up with some way to address the pandemic's heavy human and economic toll. So where are we headed for the next few weeks, and what will truly build back this broken American economy? We have a segment of our conversation with ITV Go's senior political commentator, Mr. Rohit Vyas. Here is the story. During the inauguration ceremony, which mainly would be virtual for all of us because of the safety issues with COVID-19, that President Donald Trump may be hosting his own event. We were just talking about the Senate, just let's quickly talk about what's happening in Georgia right now. John Ossoff and Raphael Warnock are challenging incumbent GOP Senators David Perdue and Kelly Loeffler. Today, President-elect Joe Biden is visiting Georgia to campaign for the Democratic challengers. How are you looking at this race? And according to you, what issues are at stake during this election? You know, what is going to matter in that Senate if it is flipped?
I think it's this race is basically critical for both parties. Even if the two seats do go to the Democrats, by the way, which we don't know, we have no idea, but if they do, there's still going to be a tie. Basically, the Senate's going to be equally balanced with 50 each. And there's going to be a tiebreaker vote, which Kamala Harris as vice president would exercise if they have to proceed with the Democratic and Joe Biden agenda. This race in Georgia, instead of being a local race now, has become a national race. Usually Senate races, in states, just like congressional races, are more dealing with local issues. This one has turned out to become a national debate. And it's going to be that way until the election day that comes up in January, the first week of January. And what's going to matter is what's going to be hanging in the balance is the future of the country entirely. So essentially, you've got these two races that are going to be interpreted as having national depth, rather than local Georgia depth. Georgia is just going to be the state which is going to be showcasing this, but it's going to have national implications as to the balance of power in the United States Senate.
Wow, yes. Georgia has been such a key player in this election, just became a swing state out of nowhere. Very interesting. You know, while we are talking about politics, another breaking news that shocked everybody was Attorney General Barr's resignation, which is coming just a few weeks short of the inauguration day. Why is he deciding to resign right now? Just before the inauguration, just before basically the term of President Trump is going to be over. Why resign now, and what kind of a message do you think that sends?
I guess the message was very clear that he has lost the confidence of the President of the United States. President Trump has made it very clear that he is miffed, to say the least, at William Barr, because William Barr said very clearly early on, well, at least a few weeks ago, that the Justice Department found no evidence, absolutely no evidence of wrongdoing during the elections, of orchestrated fraud or any such thing. And once he said that, he was history, basically. I am surprised that he resigned before Donald Trump fired him. And I think he sort of knows Trump well enough to realize that it's a dead end now. And if he doesn't resign, he will be fired, which would be more humiliating. Because I do think William Barr has displayed a certain ego as well. Out there, every time he's spoken, he has seemed to display this ego. And I think that ego would have been seriously damaged had Donald Trump said, you're done, your history, get out of here. So it was a bit late. I think he should have resigned sooner after having come to the conclusion that there was no orchestrated fraud, organized fraud during the election. And he should have quit sooner, but better late than never.
Well, this is all for tonight's show. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. Remember, you can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.